Well, good afternoon. My name is David Lakey. I currently serve as the Vice Chancellor for Health Affairs at the University of Texas System, and it's a privilege to be here today. And in my 4 minutes, I'm going to try to discuss with you several important programs we have here in the state of Texas to provide better mental health services to those that are hard to reach. The first point is that mental health services really are inadequate nationwide, that mental health symptoms are very common. More than 1/5 of U.S. adults have had a mental health issue in the last year. And if we look at the last decade, the number of adults with any mental health issue increased by about 30%. Likewise, during the decade, we saw a 41% increase in the number of high school students who felt hopeless or depressed. And we saw a 62% increase in suicide deaths. There's a significant delay between the symptoms when they first occur and when individuals get their initial evaluation. It's about a decade historically, and that decade has consequences where individuals' lives deteriorate in a variety of ways that I've listed on this slide. We also know that mental health resources are very limited nationwide. About 130 million individuals in the United States lived in a health professional shortage area related to mental health, and most states have less than 40% of the mental health workforce that they need. So I'm going to discuss two specific programs that are being built here in the state of Texas that came out of the 2019 legislative session. The first program is called CPAN, the Texas Child Psychiatric Access Network. It's a network of physicians based in our medical schools across the state of Texas that provide services to the primary care providers in their geographic location. And you can see in the map the different medical schools across the state and the areas of the state that they're responsible for. We activated this program in May of 2020, and currently the services are available to any physician, any primary care provider in the state of Texas, taking care of kids. If we look at this last month, we are now in about 1,755 clinics that are enrolled, about 9,400 providers, and have provided about 13,000 consults in the last year. The average response time between when a physician calls the number and receives services is just a little over 6 minutes. In a new program that we're developing right now, we started this in August, we're doing the same work in perinatal health, providing services to OBGYN, family medicine doctors, people that take care of women during that first year of life after delivery. The second program is the Texas Child Health Access through Telemedicine. Basically, this provides a mechanism where if a teacher or a counselor has a child that they're worried about, they can very rapidly get the child into mental health support. The first child was referred to this program in April of 2020. We currently are in 3,706 schools, and you can look at the rest of the data on the slide about our current activity. But that covers about 2.4 million kids. We've been directed by the legislature to build it out to any school that wants the program, and with that, we will cover about 5.4 million kids here in the state of Texas. For both of these programs, there's significant challenges and barriers. One has been building out large programs in the midst of a pandemic because people don't want to move. And so the workforce has been challenging, and building that workforce we need here in the state of Texas. And it's been important to build trust with our primary care providers in the schools that we're trying to serve. Next, it's a challenge related to the schools related to space. And some of the schools don't have the broadband capacity that you believe that they should have in order to provide these services. And then finally, there are some changes that were made available during the pandemic that made the prescription of medications through telemedicine more readily available. And we're concerned that with the end of the pandemic and the end of the public health emergency, that it may become more difficult in the future. Thank you very much. I look forward to talking to you in person in the future.